Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and make a better system for all of us. We have a lot of topics today, including one unusual medical study and some news about the Affordable Care Act and insurance levels. Anyway, before we get to that, let me point out that down below in the YouTube description box, you can find a link to the Healthcare Advocacy newsletter, which is the text for today's video. You can go there and you can go there and subscribe for free, and you'll find all of the links to the studies and medical articles and research, news things. You'll find references for interesting medical organizations. You'll find references in case you need to get an abortion or need reproductive care. You'll also find what to do in case you have a medical claim that's been denied, and teach you how to go after them and get them to hopefully pay for it. Anyway, so let's get started. The first topic I have is about vitamin D and how important is it? Well, new research reveals that vitamin D might play a more significant role in overall health than previously understood. Now, in the last 5 or 10 years, people have been saying that it's important to have, so many IU of vitamin D, generally D3, to boost your immune system or to keep you kind of healthy. Anyway, a comprehensive review was done of 99 randomized controlled trials involving 17,000 patients worldwide, and it offered some new insights into some other benefits that may be available from vitamin D supplementation. The key findings suggest that taking an average of 3,320 IU, this is probably an average over the studies, of vitamin D may lead to improvements in several health markers, including reduced blood pressure, lower overall cholesterol, decreased hemoglobin A1C, which is a marker for type 2 diabetes, and improved fasting blood glucose and insulin levels. Dr. Simin Liu, who was the study's lead author, noted that they found vitamin D supplementation provided the greatest benefit to non-Westerners. So I think this was done in Asia. People with lower levels of circulating vitamin D in your blood, so you're already short on vitamin D, and individuals with a BMI, body mass index, below 30 and age 50 and over. So that's kind of an unusual collection. I think the studies, keep in mind, were not done in Western countries, which may be important. This finding is particularly relevant for older adults, as older people tend to have less vitamin D as they age in their bloodstreams. The research indicates that those with initially lower vitamin D levels could benefit from supplementation. I think that's probably not a surprise. However, it's crucial to interpret the results cautiously, is what Dr. Jane Morgan, who's a cardiologist not involved in the study, suggested. She goes, there is a plethora of studies demonstrating a link between taking vitamin D, and lower risk of heart disease, but they don't have a direct cause and effect link. So they can see there's a correlation. Remember, correlation is not causation. Anyway, the study emphasizes the need for a personalized approach for vitamin D supplementation. Factors like ethnicity, which we mentioned, age, body weight, and current vitamin D levels will all influence whether there's a potential benefit. Now look, before you consider taking vitamin D supplements, talk to your doctor or your healthcare professional. They can determine whether supplementation is appropriate for you and recommend a correct dosage. If you are taking medicine to control your A1C, I know this mentioned diabetes, do not stop taking your medicine. You got to make sure you talk to your doctor first. Don't rely on studies like this to change your medication. Okay. For more details, I have a link to the story there. Let's talk about the Affordable Care Act, because it's coming up to enrollment time for the Affordable Care Act. In most states, the Affordable Care Act's annual open enrollment season for health plans begins about November 1st, and it goes all the way through January 15th. And I have a link to a Kaiser Family Foundation story on it. You can go there for full details. In most states, consumers have to enroll by December 15th in order to get coverage that begins on January 1st. Heads up, in Idaho, where open enrollment started earlier on October 15th, but it ends sooner, closing on December 15th. In California, New Jersey, New York, Rhode Island, and the District of Columbia, residents can enroll through January 31st. Current enrollees who do not update their information or select an alternative will be automatically re-enrolled in their current plan, or, if that plan's no longer available, into a plan with similar coverage. If we had universal health care, we wouldn't have this discussion. Now, some health plans offer small dollar gift cards or other incentives to encourage participation in wellness efforts. They would not offer cash cards worth thousands of dollars a month to help pay groceries or gas or rent. That's just fake. Anyway, even so, social media and online sites are rife with lots of promises like that. Those, I got to tell you, what those are, that's usually if they can get people to sign up for joint Medicaid and Medicare, they make so much money from the federal government they can afford to toss you a couple of bucks. Anyway, such ads are among the avenues allegedly used by unscrupulous brokers who abound in the world of selling health insurance to enroll people into switching plans without the express permission of consumers. This happened last year, and actually a lawsuit was filed in Florida recently about this. People were switched out of their plans without their knowledge, and the government has taken action about it. We'll talk about that in a minute. I want you to also be very cautious about websites you use when you search for coverage. If you go to your search engine and type in something like Obamacare or cheap health insurance in the search engine, what pops up are sponsored private sector websites unaffiliated with the official state or federal government marketplaces for ACA coverage. They try to look official, but they are not. Many sites offer lots of options, including non-ACA coverage with very limited benefits. There was actually a secret shopper study, I think I have a link to that found exactly that in 2023. Such non-ACA coverage does not qualify for federal subsidies helping consumers pay premiums. What they're selling you is junk insurance. Anyway, the fine print on some of the websites says that consumers who provide personal information automatically consent to be contacted by sales agents by phone or email or text message or by automated systems with pre-recorded messages. When exploring plans, always start with the official federal marketplace website, healthcare.gov. Even if you don't live in one of the 29 states that's served by the federal marketplace, that website provides the link to your state or location's official enrollment site when you select your state or the District of Columbia from a drop-down list, and you're guaranteed to go to the right place. Federal and state marketplaces also have call centers and other ways to get enrollment assistance. The Find Local Help link on healthcare.gov, that's the place to go, for example. That'll give consumers a choice in finding real assistance or sales agents near them. Warning, regulators are seeing an increase in complaints from consumers about offers of health coverage requiring consumers to join a limited liability corporation or otherwise attest that they work for a specific company. Indeed, in 2 states, at least 2, Maryland and Maine, they have issued warnings saying that instead of comprehensive ACA coverage, these are often non-ACA products amounting to a hodgepodge of discount cards or very limited indemnity plans. This type of plan pays a flat dollar amount, like $50 for a doctor visit or $1,000 for a hospital stay, and is meant to be an addition, optional on top of regular comprehensive insurance. It is not a comprehensive policy, nor will it replace a comprehensive policy. Don't fall for it. Unlike major medical plans, some of these self-funded plans only cover preventive services like a yearly checkup or an annual health screening. This is a warning directly from the Maine Bureau of Insurance. Some other changes this season. People often referred to as dreamers because they qualify for deferred action for childhood arrivals, a federal program that offers some protection to those brought to this country as children without proper immigration documentation. Good news, they can now enroll in ACA coverage and are eligible for subsidies. Short-term plans, which are technically not ACA coverage and not subject to its benefit rules and pre-existing benefit protections, that is, pre-existing condition protections, can be issued for at most 4 months of coverage based on a new government administration action that took effect with plans starting on September 1st. It walks back a Trump-era disaster rule that loosened the requirements to allow insurers to offer that coverage for 364 days and allowed it to be renewed for an additional 2 years. And let me go off script here and tell you, those plans were generally catastrophic illness plans with super high deductibles, and they're the kind of thing that throw people into bankruptcy. Like your insurance doesn't pick up until your bill is $15,000 or $20,000. What happens is those people don't go to the doctor. When they do go, it's too late. Okay, don't fall for this. Pay attention to the new rules. Now, consumers who did rely on those longer periods with these junk insurance plans, they need to check their plan's details and consider enrolling in a real ACA plan to avoid a situation in which their short-term plan expires early or mid-year, leaving them unable to get coverage elsewhere because you let the enrollment period pass you by. Look, the sign-up process could take a little longer too. New rules are in place if you switch coverage to help thwart fraud. Remember, I told you that people were switching people out of plans and into new plans without their knowledge. That was last year. They've gone after them and they're now taking action on it. If you are working with a new agent, one who wasn't already listed on your ACA plan, you will likely need to get on a 3-way call with the federal marketplace to confirm that you are indeed authorizing that agent to make changes to your policy for the coming year. Plan on this taking additional time. No one knows how busy the call lines will be, so you probably want to think about enrolling early. Consumers need to weigh not only their monthly premium cost, but also variations in deductibles and co-payments for such things as doctor visits, hospitalizations, and drugs and procedures and tests. Another consideration when choosing a plan is to check whether its network includes the doctors and hospitals you typically see, as well as whether its formulary, that is the covered prescriptions, match the medicines that you need. I include again a link to the Kaiser Family Foundation article. They had even more warnings. Go there, read it, and protect yourself. P.S. If we had universal health care, we wouldn't be having any of this discussion. Okay, let's talk about uninsured people. I got an email this morning from the Congressional Budget Office because I'm on their friend list. Anyway, the Congressional Budget Office just did an estimate of how many people didn't have health insurance in 2023. Good news, it was 7.2%. The bad news is that number is on the rise because of Medicaid unwinding. But still, that's 7.2%. That's 25 million people. The rate is expected to reach 8.9%, higher than it was during the 2021-2023 period, but lower than the 10% in 2019, in 10 years. The Congressional Budget Office attributes much of the increase over the next 10 years to the end of Medicaid's continuous eligibility provisions in 2023 and 2024, and the expiration of enhanced marketplace subsidies after 2025. There are a lot of people in the middle income levels who get some assistance on their insurance premiums from the federal government. When that goes away, a lot of those people are going to stop buying insurance. It's the wrong decision, but they're in a situation, the system is set up in a situation not to their benefit. The largest increase in uninsured population between 2024 and 2034 is going to be adults between 19 and 44. I have a link to the Congressional Budget Office report, and you can go there and take a look at how they did the analysis. But you already know how to fix this. It's universal health care. So it's time that we let our elected officials know that this is in their ballpark to fix. Here's the link to contact our members of Congress. I have it included in our YouTube description box, and it's in the newsletter. In the newsletter, I have a brief typo. It's 7.2% of the people. I thought I fixed that. It's 7.2% of the people are uninsured. That's about 25 million. It is projected to rise to 8.9% in 10 years. Universal health care is better coverage for everybody for less money. In fact, if you need something to put into your talking points, if you call them on your own, you can tell them that according to the Congressional Budget Office, just dropping the overhead of commercial insurance saves $400 billion, and I believe there's another $200 billion in savings on prescriptions. This is for the whole country. $600 billion. That's out of about 4.5 trillion. You know what? It's almost a quarter. It's about 20% savings for everybody. Okay, or my favorite, use ResistBot on your cell phone. Send this text message to 50409. Sign, SIGN, space PGRMMW. Sign PGRMMW to 50409. I'll read it to you. I'm your constituent, and I want you to know that there are 25 million of us without health insurance. Tens of millions more have so-called junk catastrophic high deductible plans. The CBO just estimated that we're at 7.2% uninsured and heading to 8.9%. And here's a link to their analysis so somebody in the legislative office can read it. We are wasting hundreds of billions of dollars every year, more than 400 billion according to the CBO. I want you to read up on universal health care. Here is a link to the text of HR 3421. It looks like a typo there. I think I have 2321 in my email. I'll fix that. It is about 100 pages long, but it is very comprehensive, and it would cover all of us for a lot less than we spend now. And here is a link to the text. P.S. The Kaiser Family Foundation just reported that an employer-sponsored health plan for a family is now $25,000 a year. I hope you don't feel good about that. Pass universal health care. It is a sure way to show your constituents that you actually care about them. Thank you. Down below in the YouTube description box, you can like, share, and subscribe. Send me comments there or at healthcareadvocacy1@gmail.com. Have a good evening.